Hi there, welcome to a presentation by CBH Education in our pharmacy revision series. Today we're going to be looking at antimicrobial stewardship, antimicrobial resistance, and elements to help you in terms of your professional development if you're a new pharmacist, pre-reg and OSCEs. Okay, so antimicrobial stewardship. This is an agent derived from any source such as microorganisms, plants, animals, synthetic or semi-synthetic, that acts against any type of microorganism such as bacteria, mycobacteria, fungi, parasite, and viruses, and all antibiotics are antimicrobials. This has been grouped together because there is actually a crisis going on globally, and one of the things is there's now a concerted effort globally to ensure that antibiotics are not just sold over the counter. So in some countries you can get antibiotics without a prescription. Other countries, such as the UK, you need to be reviewed by a clinician before it is even prescribed to you. So one of the things that's been done at a ground level now is increasing awareness of resistance through education and training, create a base to identify evidence and share this effectively. So cases that come to light where there's resistance going on, that is reported, discussed in clinical meetings, introducing hygiene measures. Now you've seen now with COVID as well, we've had social distancing, we've had hand sanitizer, we've had the lockdowns, and then obviously the optimization of antimicrobial prescribing. So these will change every single year, and these are effectively found in formularies. So there'll be a guide on how to treat example like COPD, urinary tract infections, acute sinusitis, and then obviously deliver innovation for antimicrobials. So one of the key things here is looking at new antimicrobials, bringing new antimicrobials to market, collaboration with university and industry. Check your local formulary for updated guidance. So obviously, looking like I said, there has been an evidence change from NICE. This has been updated in your formulary. Now, obviously, you've got to review how long have the patients had the antibiotic and what is the indication, laboratory testing, and development of IT system. So basically, that's making sure you code the correct indication. It comes up onto the GP system as well. It comes up onto the pharmacy system as well, identifying that obviously they've been overprescribed antibiotics or they've had antibiotics previously. So it flags things up. So there's systems there that will identify, right, the patient has had this, and then obviously what kind of action do you need to take as well. Antimicrobial resistance. So there is a surveillance program in the UK now. Self-limiting respiratory infections don't require treatment. Principles of antimicrobial stewardship, which we've discussed as per NICE and the World Health Organization. Patient use and monitoring this. So what will happen is you'll get a monthly report. So on your GP system, for example, if you're doing a placement in GP practice, one of the things is you can create a search, and even CCG Medicines Optimization pharmacists create searches to review the prescribing of antibiotics and identify which patients are having it long term. And then obviously using broad spectrum antibiotics such as carmoxyclav, quinolones and cephalosporins should be reserved for second line treatment. So obviously, one of the things that we do have is we are looking at how to prescribe antibiotics, but we've got to do it in a safe and rational way. And prescribing in a safe and rational way means having contact with the patient, reviewing them. So every time a request comes up for antibiotics, one of the things that you have to do is obviously review the patient and see, right, is it suitable for the indication? Can we prescribe it and base it on that clinical judgment as well? Other things you have to do is, if, for example, nitrofurantoin, you have to review the EGFR, for example. Trimethoprim is a patient on methotrexate or cotrimoxazole, you can't prescribe those antibiotics. And then obviously looking at things like allergies, really important here. When allergies are involved with antibiotics, you've got to have it documented clearly. And even in your consultation as well, when we come on to our presentation consultations, the key thing is always looking at that antibiotics with allergy. Okay, so some of the things that you might come across in your OSCE, pre-reg exam, and even your practice is situation where there's an antibiotic prescribed long term. So, for example, trimethoprim for the prophylaxis of UTI. How long have they had it for? Greater than 6 months? Has it been reviewed? Is it under a consultant? Are they on rotational antibiotics? Are they on antibiotics for the infective exacerbation of COPD? And you've had 4 issues in the last 4 months, right? How is that being prescribed? How is that being rationalized as well? And does it mean current evidence? So what we mean by evidence is this term evidence. You've got local formularies, you've got national formularies as well, and then obviously you've got the scale of evidence talking about things like randomized controlled trials, all the way down to expert opinion. So one thing is that the evidence will be in the NICE guidance or your local formulary. Now, has the patient been reviewed? Obviously, during the COVID time, patients haven't been reviewed, but obviously you've got to have a plan in place, and that's where the audit comes in. So in a community pharmacy, how often are you dispensing the antibiotic? Are you picking this up? Is it being referred back to the prescriber, so the clinician? Now, how often are patients returning because they still feel unwell with treatment with one antibiotic? Is it because it's resistant? Have you taken the sputum sample or the recommended sample that's needed to ensure that you're prescribing the right antibiotic so that it's sensitive to the needs of the patient? Okay, and then obviously where you need to do extra care is COPD rescue packs and obviously the prophylaxis of UTI. These are kind of two core clinical areas that obviously pharmacists generally are looking at obviously sorting out procedures and obviously reviewing patients when they've had this long term as well. And then obviously if there is a problem and you find that everything is resistant, then obviously you need to refer to your local microbiology teams in secondary care. So for example, a patient may have a resistant strain to a specific UTI and would need to go into hospital to have intravenous antibiotics. Sometimes they may have to have aminoglycosides as well, which requires obviously therapeutic dose monitoring. So in these situations, it's really important. So when you're presented with a situation with an antibiotic and a patient's had it long term, even in a test through pre-reg exam, it's really worth looking at, right, how long have they had it for? What is the core indication? Are we using current evidence as well? Even potential drug interactions, looking at that. So we'll go through drug interactions more in the OSCE session on antibiotics. And then obviously, are we giving the right quantities as well? We're not over prescribing. So this is where the core issue tends to come in, and making sure that we're obviously ensuring that we're prescribing safely, but also for the patient's therapeutic need as well. Thank you very much for listening to this presentation by CBH Education in our pharmacy revision series. For more videos on our pharmacy revision, pharmacology revision, OTC conditions, OTC medications, legal aspects of prescribing, please follow us on our Facebook, Instagram, and YouTube channel.